Hey guys, hello and welcome to our YouTube channel. In today's video, we are going to take on RPGN or the rapidly progressive glomerulonephritis. So in this video, we'll talk about the clinical features of RPGN and also we'll take on the diagnosis, like how do we diagnose the case of RPGN. So let's take on the clinical features first. See, RPGN is a kind of nephritic syndrome, but what is peculiar in this case of nephritic syndrome is that this kind of nephritic syndrome will lead to renal failure within days or weeks. Okay, so it will lead to renal failure within days to weeks. Okay, so initially the patient will present with the feature of the of the nephritic syndrome like hematuria, oliguria, hypertension, and RBC cast in the urine. So initially the patient will present with the feature of the nephritic syndrome and will think that the patient has nephritic syndrome. But what will happen in days to week that the patient will start presenting the feature of acute kidney injury, okay, or the renal failure. Okay, that is, there would be electrolyte imbalance, there would be elevation of blood urea nitrogen, there would be elevation of creatinine, okay, there would be hyperkalemia, etc. There would be metabolic acidosis. So this is all the patient will present, and these constitutes the clinical findings in case of RPGN. So again, RPGN is a kind of nephritic syndrome in which initially we have the features of nephritic syndrome, like we have hematuria, we have oliguria, we have hypertension, we have RBC cast, but within days to week the patient will start presenting the feature of acute kidney injury or the renal failure, like there would be elevation of blood urea nitrogen, there would be elevation of creatinine, there would be elevation of potassium, and there would be elevation of hydrogen leading to metabolic acidosis. So as these things occur, we will think that the patient has something wrong with the kidney and will proceed with the biopsy of kidney. Okay, so next we'll do the biopsy. Okay, so we will do the biopsy of kidney, and what we will see in biopsy of kidney is what is the pathognomonic of RPGN. Okay, so this is the histological picture which we will see in the biopsy of kidney. And what is most important over here is that there would be the formation of crescents within the glomerulus. Okay, there would be the formation of crescents. Okay, there would be the formation of crescents within the glomeruli. Okay, so this structure is the crescent which is formed in the glomeruli. Similarly, in this glomeruli there is the formation of crescent. Okay, so whenever there is the formation of crescent, we will be sure that it is a case of RPGN. Therefore, RPGN is also called as crescentic glomerulonephritis. Okay, it is also called as crescentic glomerulonephritis. Nephritis. Okay, so it is also called as crescentic glomerulonephritis. RPGN is also called as crescentic glomerulonephritis. Okay, so the biopsy will show us the crescent. Now this is all about the clinical features of the RPGN. Okay, and what are the biopsy findings in case of RPGN. Now after this we will start to make the diagnosis. Okay, this is the second part of our video, that is how to diagnose the RPGN or the causes of RPGN. Okay, to make the diagnosis of RPGN, what is the most important thing? It is to do immunofluorescence. Okay, it is to do the immunofluorescence. Okay, so depending upon the findings in the immunofluorescence, we can have the different causes of RPGN. Okay, the first scenario is that we will get linear immunofluorescence. immunofluorescence. Okay, if we get linear immunofluorescence, like on the immunofluorescent assay, let's say it is all linear, then the cause of RPGN is Goodpasture's syndrome. Okay, it is Goodpasture's syndrome. Okay, to give a quick idea about the Goodpasture syndrome, actually in this case there is the formation of antibodies against the basement membrane of glomeruli. Okay, against the basement membrane of glomeruli plus alveoli. Okay, so as a result of this, due to the formation of antibodies against the basement membrane of glomeruli, there is nephritic syndrome, and also it progresses to RPGN and causes RPGN. Okay, initially it is nephritic syndrome, but then it causes RPGN, and due to the formation of antibodies against the basement membrane in the alveoli, there is hemoptysis. Okay, hemoptysis means the blood is coming in the cuff. So this is all about the linear immunofluorescence. Again, if you get linear immunofluorescence, then it means that the cause of RPGN is nothing but it is Goodpasture's syndrome. Okay, now if we get granular immunofluorescence, okay, if we get granular immunofluorescence, then there may be two conditions. Okay, it may be due to post-streptococcal glomerulonephritis, which is a cause of nephritic syndrome, and I have covered post-streptococcal glomerulonephritis in one of my videos. You can check it out. And the second scenario is that there may be diffuse proliferative glomerulonephritis. This is another kind of nephritic syndrome, and I have covered this thing also in my videos. Okay, so again, if it is granular immunofluorescence, then the cause of RPGN can be post-streptococcal glomerulonephritis, or it can be diffuse proliferative glomerulonephritis. So now let's say if the immunofluorescence is neither linear nor granular, instead there is no immunofluorescence, okay, or there is less immunofluorescence or quasi-immunofluorescence. In that condition, the cause of RPGN is one of the vascular diseases. It can be Wegener's granulomatosis, okay, it can be Wegener's granulomatosis, or it can be microscopic polyangiitis. Okay, it can be microscopic polyangiitis. Okay, so I am writing in short. It can be Wegener's granulomatosis and it can be microscopic polyangiitis. So in this case, what do you do is that you go for the assay of anti-nuclear antibodies. Okay, anti-nuclear cytoplasmic antibodies, or the ANCA. And in case of Wegener's granulomatosis, we have C-ANCA. Okay, and in case of microscopic polyangiitis, we have P-ANCA. So what is the algorithm? The algorithm is that if you get no immunofluorescence or if you get quasi-immunofluorescence, you go for the anti-nuclear cytoplasmic antibodies, and if it is C-ANCA, then it is Wegener's granulomatosis, and if it is P-ANCA, then it is microscopic polyangiitis. So this is all about the diagnosis, and please make it sure to learn that the diagnosis of RPGN relies entirely on immunofluorescence, but to be sure that it is RPGN, you have to do the biopsy first. So this is all about today's video, that is RPGN, or the rapidly progressing glomerulonephritis. So for more videos like this, please make sure to subscribe to our YouTube channel, and also we are on Instagram and you can connect to us on Instagram. Thank you.